So men will be happy to know that they can freeze their sperm.
Yes, that we also do freeze sperm on cases, for example, prior to chemotherapy, for example. Now, I wanted to tell you a little bit more about in vitro fertilization, just because it's such a common treatment. And when we do that, actually, the idea is not to have 1 or 2 eggs like an insemination. The whole idea is to give medications for about 10 days.
What are those medications, by the way?
It's gonadotropin, so it's FSH and LH. So the same hormones.
They're hormonal.
The same hormones that the woman produces for 1 egg, we use for 10 days, and they're injected. Small injections, subcutaneous, and that for 10 days, the woman will produce maybe, ideally, 10 eggs from each ovary. So at the end of those 10 days, the eggs are ready. And then we do, again, the same procedure that we do for egg freezing. We do an ultrasound where the patient's asleep, so she's completely comfortable and fine. It takes about 20 minutes. Little needle goes inside, and then we remove the eggs. Nothing from above, it's all transvaginal. Once we remove the eggs, if the idea is to do egg freezing, they're frozen, right? But when we do in vitro fertilization, the patient's trying to get pregnant. So what we do is we take those eggs, we combine them with sperm, and then we wait 5 or 6 days until that embryo grows in the lab. And this is all
microscopic at this point, right?
Yes, microscopic. Actually, after 5 or 6 days, the embryo only has about 200 cells. At that point, we can do one of 2 things. We can either take that embryo, or 1 or 2, and place it in the uterus, or for women that are older than 35, what we recommend doing is actually doing genetic testing on the embryo. So we take a few cells from the embryos, let's say we have 2 or 3, few cells from each, freeze the embryos, and then we get the report 2 weeks later that says, this embryo is normal, and that way we rule out many genetic conditions that go up or increase the risk with time.